and you mentioned Bev, and she's just been such a champion around provider status and expanding the role of pharmacists. And we've got a lot of just phenomenal people that have done a ton of great work over the years to get us to the point that we're at now. And so in 2017, a law in Washington State went into effect that allows community pharmacists to basically participate in medical billing for any clinical services. So it's that provider status that we'd all been seeking. We finally had that mechanism to do it, and so we jumped on it and went through the credentialing and contracting process, and we're able to contract with a number of the large commercial health plans in the area. And we'd already started our PrEP clinic, and it was kind of a different model from what it is today, and we adapted it around this opportunity with provider status billing. And so our PrEP clinic is unique. It's a pharmacist-driven clinic, and it actually started as a residency project. We have a community residency program, and our resident and one of our clinical pharmacists came up with this concept of providing PrEP. And this was at a time when nobody was doing PrEP. Nice. They pitched it to us as a concept for a project, and sounded amazing. So we ran with it, and so it's all pharmacist driven. Everything happens in the pharmacy. So somebody interested in HIV prevention, they schedule an appointment, and they come in and meet with the pharmacist. We do all of their labs in the pharmacy. And if appropriate, they're initiated on PrEP, and all of this happens in one visit in about an hour. So we call it one-step PrEP. It's one of those things that we've just been able to, find ways to remove all of the barriers to patient access and make it really easy for people. And it's been absolutely phenomenal. And it's grown to the point now that we're actually able to bill for our time and not worry about the reimbursement on the product, that it is fully self-sustaining, and we're actually building and expanding out just clinical services at this point, because we've got a model that works. So it is possible.
That is so cool, man, because that's like really the ideal scenario. I know so many pharmacies across the country would just, are saying, see, this could work. We can take so much burden off of the healthcare system. We can move that burden over here. Pharmacists are trained to do that. We have those connections in the community. Put me in, coach. But up there in Seattle, you guys have been able to really take that model. So if anybody outside of the world of pharmacy is watching this podcast, they may not realize that pharmacists, even though they're trained in a lot of states, a lot of areas, can't use their training to provide those services that they could provide so well. And even when you have pharmacies that do, a lot of times they're offering those services and not being reimbursed for them. So, it's really like the pinnacle of that, operating at the top of your license, where you're performing those labs, you're taking those clinical results and documenting, e-care planning, providing the prescriptions that accompany that use case. And then, really it's like you said, that one-stop shop. So I guess two-part question, where do you see that moving forward in your community? I know there's some other areas that you can apply that, but then, what do you think the holdup is in other states that haven't granted that provider status?
Yeah, well, as far as other states go, I know there have been a lot of great efforts around the country, and other states are starting to see some progress there. And I know there's a handful of other states now that have similar laws on the books. So I think we've got some good model legislation out there now. So it's just a function of staying engaged with your legislative efforts, and partnering with organizations that are going to support that messaging. We had great partners in the schools of pharmacy here in Washington State, and the Washington State Pharmacy Association really led that charge. But supporting those efforts, supporting your professional organizations so they can get that work done. But it's coming. It's not coming as fast as it should, but we're getting there. And I think we've got some really good examples of how we can provide collaborative services to our community that improve outcomes, reduce costs. And as far as where we're going with this, it's always a great question. But there's we're still putting energy into PrEP, but I think there's just again working with public health. I think there's so many opportunities where we can do things that are collaborative, that are going to engender the support of the healthcare community. So hepatitis C is kind of our next big effort. And I'm still very much interested in overdose prevention efforts. So with some of the populations that we work with, all of these things are sort of coalescing. And so we're trying to figure out, okay, how can we take what we do and take it out further into the community? So we're working with, again, I mentioned, some of the local organizations here that are providing supportive housing as they transition people from homelessness into supportive housing that have some form of integrated health care, taking our pharmacists and embedding their services within these organizations to kind of expand our reach and expand the offerings that we're providing in the pharmacy, taking it to the point of need. So that's kind of my vision for where some of this is headed. But it's I think there's plenty of opportunities out there, but you have to be willing to look in non-traditional places to find them, I think.
Thanks for listening to this clip from Beyond the Scripts, presented by the Catalyst Pharmacy Podcast. If you enjoyed this episode, please support our channel by liking, subscribing, and clicking the notification bell so that you'll be notified anytime we post new content. To stay up to date with all of the latest independent pharmacy news and content, follow PioneerRx on your preferred social media platform.